This is one of the incisors. The incisors are the front teeth. Their purpose is to cut or tear the food into smaller bits as you eat. Looking on the outside, the different parts of the tooth, this lower portion here, which is below the gum line, is called the root. The neck is this transition period from below the gum line to what is exposed above the gum line, which is known as the crown. So you have the root, the neck, and the crown. Now, if we take this apart and look at the inside of it, this outer portion up here, remember on the outside is the crown, this is the enamel. This light brown inner layer, that is the dentin. And then in the inside here is a cavity. That's the pulp cavity. And inside here is where you can see you have the blood vessels, you have the nerves, which are coming through from down here. So one of the concerns that a dentist is going to have with his patients is, depending on their diet, etc., are they wearing away the enamel, this outer layer here that's protecting the dentin, which in turn is protecting where the nerves and the blood vessels are. Another just FYI, if you have a root canal done, what they are doing is that typically you have had an infection, you may even have an abscess in this pulp area. And so if it's extreme enough that it cannot be treated with antibiotics, for a root canal, if that's the decision to do that, what they will do is actually go in and clean out this entire pulp cavity. So they're going to essentially remove the nerve, remove the blood vessels in there, and then they will fill it in to prevent any additional infections from occurring.